Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral, fully occluding, soft, sticky, fudge caramel-like consistency earwax. And I'm just commencing with this there right ear. This is the ear that they felt to be the worst. And as you can see, this wax is quite dense. And when you've got a consistency of wax like this, it's very difficult for it to travel up the suction tube, and even if it does, it's prone to getting blocked inside. So immediately I've reached out for olive oil spray, and we are now suctioning whilst the oil's in situ. So I've not drained the ear, I've just filled up the ear with the oil, and whilst the oil's in, I'm continuing to vacuum. And what the oil will do, will do several things. It'll help to lubricate the ear canal wall, so there's less friction as I'm bringing this wax plug out. It will also lubricate the inside of the suction probe to prevent the wax from getting blocked. And it also helps to bind the wax together. When you've got a very dense, soft plug of wax like this, if we can firm it up slightly and bring it together, the plug can come out in a single piece. And the technique I'm using at the moment, just reaching to the bottom of the wax plug and lifting up. And that's because you will see, once I get this wax plug out, that this patient's got quite a prominent inferior recess. So our ear canals, as they travel towards the eardrum, there's a slight incline, and that incline is approximately 32 degrees. But about half a centimetre in front of the eardrum, the ear canal suddenly dips down, and that creates a recess, an inferior recess. You can probably see that there's a little trench there at the bottom of the ear canal near the eardrum, and quite often wax can get trapped there. So when I was bringing this wax plug out, I was purposely lifting the plug upwards so it can escape out of the inferior recess, and then I slowly brought it forwards. So this is the patient's left ear. On both sides, actually, the ear canal entrance was slightly narrowed. Once more, this wax is very dense. It's very sticky and stodgy. It's got, again, a caramel toffee-like consistency. Without any further delay, I've just instilled the olive oil spray, and you can see just how much of a difference it makes. It really helps me to remove this plug. Now, this left ear was very bendy. The endoscope is actually positioned directly into the ear canal, but the ear canal veers off to the left. And what I'm going to do now, I'm going to straighten the ear. So I'm lifting the ear up, I'm entering with the endoscope first, and then stretching the ear open. So I'm pushing the endoscope to the right hand side against the cartilage to keep the ear canal open. And whilst I'm stretching it, and then with my wrist angling the tip of the endoscope almost back upon itself to the left, where the ear canal bends and straightens up. So behind this wax plug is directly where the eardrum is. Previously, the endoscope was angled to the right hand side, so the back part of the ear canal. Similarly to their right ear, lifting this plug up, you may already see this patient's ear canal has got a very sharp V bend at the base of the ear canal, so that they've got a deep valley. And then to the left-hand side, the ear canal is almost like a step. The ear canal goes up, then it plateaus, and then it goes back up again. So a slight abnormality there. And again, that potentially can be a cause as to why this patient's suffering from a wax buildup. The wax plug's getting trapped due to the anatomy of the ear. So this patient's got a very prominent anterior recess. So behind that canal wall, there's a big recess. The wax can get trapped behind that. So just a little bit of wax just on the anterior superior canal wall laterally. So when we say anterior, we mean the front part of the ear canal. Superior is the roof, and laterally is near the entrance. So when we discuss the ear anatomy, we use these terms. I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.